What happens when the rules that protect our animals from deadly diseases are suddenly changed? Under the Trump administration, major shifts in veterinary policy have sparked serious concern. From slashing disease monitoring staff to stalling the release of urgent health data, the nation's defense against outbreaks may be weakening. Could this mean more disease threats ahead? Not just for animals, but for us too? In today's video, we'll break down what's happening, why it matters, and what it could mean for your food, your safety, and the future. So, without any further delay, let's get started. Understanding the policy changes. Under the Trump administration, a series of veterinary policy changes have raised significant concerns about the future of animal health. Key programs designed to monitor and respond to animal diseases have faced major cuts. For example, approximately 140 staff members from the Food and Drug Administration, FDA, were dismissed, including experts responsible for handling outbreaks of avian influenza and other diseases. The staffing reduction has left many wondering how the government will respond to future outbreaks, which can spread rapidly across livestock populations and even affect human health. The administration's stance on streamlining federal agencies has led to budget cuts in various health and safety programs, some of which were crucial in preventing widespread animal diseases. More worrying is the increased difficulty of tracking and responding to diseases due to reduced staffing, slower information dissemination, and cuts to vital research funding. As a result, programs like the National Animal Health Laboratory Network, which coordinates efforts to identify and contain diseases, have faced staffing shortages, making it harder to contain outbreaks quickly. The decisions to scale back these policies have sparked concerns across farming communities, animal rights groups, and public health experts, who warn that these changes may increase the risk of widespread disease outbreaks. Implications for disease monitoring. One of the most concerning consequences of the recent veterinary policy changes is the impact on disease monitoring and outbreak response. Monitoring animal health is a complex task that requires consistent oversight, timely data collection, and a well-coordinated response across federal and state levels. The reduction in personnel at the FDA and USDA means that the agencies responsible for tracking diseases like bird flu, swine fever, and other viral outbreaks are now severely understaffed. This makes it harder to monitor animal populations closely and to detect diseases early. For instance, the National Animal Health Laboratory Network, which helps to identify diseases like highly pathogenic avian influenza, HPAI, has faced major challenges in keeping up with its workload. The USDA's efforts to respond quickly to outbreaks are now constrained by staffing cuts and delays in receiving accurate and timely reports. As a result, if a disease outbreak occurs, the time between detection and response may be longer, giving the virus more opportunity to spread. Additionally, the delay in reporting important findings or health warnings has hindered the flow of critical information to farmers, veterinarians, and consumers. This creates a situation where preventive measures are harder to implement, and a potential crisis is more likely to escalate. Without robust disease surveillance systems in place, public health and food security are at greater risk. The importance of biosecurity measures. In light of the ongoing changes in veterinary policies and reduced government oversight, maintaining strong biosecurity measures has become more critical than ever. Biosecurity refers to the steps farmers, veterinarians, and others in the animal industry take to protect animals from diseases. These practices are designed to prevent the introduction and spread of pathogens, viruses, and parasites that could severely impact herds, flocks, and entire regions. Key biosecurity measures include limiting farm access to essential personnel only, ensuring that all visitors follow strict hygiene protocols, and using protective equipment like gloves, boot covers, and face masks. Farms also disinfect all equipment, vehicles, and tools to prevent contamination. Another important aspect is controlling the interaction between domestic animals and wild or feral animals, which are often sources of disease transmission. Veterinarians also play an essential role in biosecurity. Regular veterinary care ensures that animals receive vaccinations and parasite treatments, making them less vulnerable to infections. Additionally, veterinarians help farmers develop tailored biosecurity plans specific to the risks on their farms. These plans focus on improving disease prevention and rapid response strategies in case of an outbreak. Ultimately, biosecurity measures are the frontline defense when federal monitoring systems are under strain. When implemented correctly, these measures can reduce the likelihood of disease outbreaks, saving both animal lives and resources. Potential consequences of reduced oversight. The reductions in veterinary staff and cuts to critical health programs under the Trump administration are not without significant consequences. The most immediate concern is the potential for faster and more widespread disease outbreaks, particularly among livestock. With fewer staff members monitoring diseases and providing quick responses, there's a higher likelihood that diseases will go undetected in their early stages, giving them time to spread across farms and regions. This risk is already evident in some recent outbreaks, such as the bird flu, which devastated millions of poultry and led to significant financial losses. Without proper monitoring and timely interventions, the scope of these outbreaks can escalate quickly, impacting not only animal health but also human food security. As the costs of such outbreaks increase, consumers may face higher prices for food products like eggs, poultry, and dairy. Additionally, weakened oversight at a federal level can affect international trade. Countries may impose trade restrictions or bans on U.S. livestock products if they perceive the nation's disease control measures as inadequate. This could harm the U.S. economy and reduce the country's competitiveness in global markets. Without a strong and coordinated response, the U.S. risks losing its ability to maintain healthy herds and manage disease outbreaks effectively, threatening both the economy and public health. The role of farmers and veterinarians. In the face of reduced government oversight, farmers and veterinarians are taking on an even more critical role in protecting animal health and preventing disease outbreaks. As the first line of defense, farmers must be vigilant about biosecurity practices to minimize the risk of disease entering their operations. This includes controlling farm access, using disinfectant foot baths, ensuring proper hygiene, and preventing contact between livestock and wildlife, which can carry diseases. Veterinarians are crucial partners in this effort. They provide expert guidance on disease prevention, helping farmers develop tailored biosecurity plans suited to their specific needs. They also conduct regular health checkups, administer vaccinations, and monitor for early signs of illness. If an outbreak occurs, veterinarians help identify the disease, advise on containment measures, and ensure that animals receive the necessary treatments. Beyond day-to-day care, farmers and veterinarians must work together to stay informed about emerging diseases and share information with public health authorities. Their combined efforts help create a strong defense system that can respond quickly to threats, even with reduced federal support. By staying proactive and vigilant, farmers and veterinarians can minimize the impact of disease outbreaks, ensuring both animal health and public safety. The shakeup in veterinary policy is more than just politics. It could impact farms, food, and families across the country. As disease threats grow, strong monitoring and biosecurity have never been more important. Staying informed is the first step toward protecting both animals and people. If you found this video helpful, don't forget to like, share, and subscribe for more updates on health, safety, and what matters most. Thanks for watching. Stay safe, stay curious, and until next time, Take care.